Vigar, can you hear me? And Isuri?
Yes, Doctor, I can hear you. Isuri, you can proceed, I believe.
Yes, sir. Apologize. Yes, I am back. I apologize for the inconvenience. We had some technical difficulties to commence. To moderate today's session, we have with us Mr. Migara Das. Mr. Das is an attorney at law of Supreme Court of Sri Lanka. He is also holder of Bachelor of Arts special degree in Sociology from the University of Colombo and a Master of Laws from the University of Colombo. Mr. Das has more than 10 years of practice in the private bar as a lawyer specializing in civil law and public law, handling cases such as family law, labor law, land law, money recovery law in civil legal practice, and handling cases in the administrative and fundamental rights law in public law practice. I also warmly welcome Mr. Migara Das for today's session. And without any further ado, I invite him to commence today's presentation.
Right. Thank you very much, Isuri, for that introduction firstly regarding Dr. Pulvikramarachi. We are most grateful, sir, for sparing your valuable time with members of the legal profession. So to begin with the topic for the day, mitigating cardiovascular risk for the health and well-being of lawyers. Now, this topic is important, ladies and gentlemen, for the reason that in the recent past, we have seen increase of heart-related illnesses and even fatalities amongst the population of this country. And also, as you all are well aware, many lawyers also have fallen victim to health-related illnesses and even fatalities. I think in that context, we need to understand the importance of this topic. Also to bear in mind that around 32% of global deaths is in fact caused by cardiovascular diseases. So therefore, without further ado, I would like to begin this discussion by starting with the most pertinent question for the day for Dr. Pulvikramarachi. Now, we as laymen, we know and we have heard about heart attacks and even strokes occurring amongst the population. But the term cardiovascular disease, I think, is something broader than that. Doctor, if you can start this discussion by enlightening us of the definition and what includes and what contains this broader definition of cardiovascular disease. Over to you, doctor.
Right. Thank you very much, Vara. Good evening to you. And also thank you, Suri, for the kind introduction. And also BSL for the invitation for me to participate in this conversation. And it's a great privilege to be here. I agree with you. The term cardiovascular disease is a spectrum. It's got a broad definition. The headliners are, as you said very correctly, are the heart attacks, the strokes, and also what we call as peripheral vascular disease. That's the blocked arteries in your legs. You may have heard some people have to undergo amputation and those things due to blocked arteries in the legs as well. So those are the three headliners for cardiovascular disease: the heart attack, strokes, and the peripheral, what we call as peripheral vascular disease. But it's a broad spectrum in that it can vary from the asymptomatic, mild coronary artery disease. Coronary artery disease is narrowings in the heart arteries, to a very significant level of coronary artery disease, to having a heart attack, to having causing heart failure or lack of pumping function in the heart muscle, and then sometimes unfortunately causing death. Now, it also encompasses strokes. So strokes also can be sometimes narrowings in the arteries in the neck, the blood vessels in the neck, causing what we know as transient ischemic attacks or mini strokes, which sometimes can lead to full-blown strokes, and then, unfortunately, sometimes even death. So it's a broad spectrum, cardiovascular disease. The most talked about, as I said, the headliners are the heart attack, strokes, and peripheral vascular disease. I think will that be a good start?
Yes, doctor, most certainly. Thank you. Thank you for enlightening us on what we actually mean by cardiovascular disease. Now, going further from that, now as laymen, we may experience cardiovascular diseases and heart-related diseases. But how can an ordinary person identify whether he's going through a disease of such nature? Now, given the fact that cardiovascular diseases can come in the form of symptomatic diseases and asymptomatic diseases. Now, what are the symptoms that one can experience if he's going through a cardiovascular disease? Also, doctor, how can one be vigilant of the asymptomatic conditions of this fatal disease?
Yeah, I mean, that's got few parts. The answer's got few parts to your question. So firstly, recognizing symptoms. So how a layperson could recognize that, okay, I've got a problem and I need to seek help. By the time it comes to that stage, of course, there's been some disease progression unknowingly, and that it has now come to a level where it's causing us to have symptoms. Now, if I go back to the three main entities that I alluded to in my first question, so first answer. So if it comes to cardiac coronary artery narrowing, the symptoms could be, unfortunately, for a good proportion of people, the first heart attack happens, abruptly. There's no warning to it. So, okay, so what are the symptoms of a heart attack? How do they present? As you all know, we say, pain or tightness or heaviness in the central or left side of the chest, sometimes the upper part of the tummy. You feel like there's a weight put on your chest, difficult in breathing. You feel sweaty, cold, clammy. Sometimes you feel like vomiting. The pain can radiate up to your neck, to your jaw, down the arm sometimes. So if you start feeling these symptoms, this could be, a heart attack. So that's recognizing, okay, an event. And sometimes it's very difficult to distinguish gastritis from a heart attack. People, if you get pain or like burning pain sometimes, in the upper part of the tummy, we think, okay, this could be just gastritis. But if it's slightly out of ordinary to you, and if it's not going away, it can be heart attack. We have seen many, many patients like that who present to us late, thinking that, oh, this was gastritis, but to find out that actually it has been a heart attack. So I think, those symptoms are, important to recognize those symptoms, see that, okay, maybe I'm having heart attack, maybe I need to go see a doctor. What would they do? They would do an ECG, a blood test, to see whether there's a heart attack or not, and then maybe a non-invasive ultrasound scan of your heart and what's called an echocardiogram. So some basic tests to rule out or rule in a heart attack. Now that's if you get to that level. Now, sometimes before that, some patients are lucky to get some warning signs. When you do some, physical activity, let's say climbing stairs or running somewhere, all of a sudden lifting some weight and trying to do something, you might feel chest tightness, heaviness, pain in the middle part of your chest again. And if you get those exertional symptoms, then you should also be concerned that maybe, I'm having what's called as angina. Angina is the pain that you get due to lack of blood supply to heart muscles due to a narrowing of an artery. It's basically a supply-demand mismatch, isn't it? So a heart is a muscle, and muscle needs oxygen to function, to breathe. And if there's a narrowing, and it wouldn't get enough blood for it to have adequate oxygen, and then starts the pain. So sometimes the first times you get is when you exert, because when you exert, your heart rate goes up, your demand goes up, and if there's a narrowing, the supply can't match the demand, and then you start having symptoms. That's when we get angina. Sometimes you don't get classical chest pain, tightness. It could be just difficulty in breathing. So that's from the heart side, in terms of how a layman could recognize. So firstly, as I said, exertional symptoms, and in some people, unfortunately, they don't get any exertional symptoms, and it could be the first symptoms could be the actual event. So we'll come to in the next few questions about prevention, recognizing, and all that. And part of your question as well, asymptomatic, how do you recognize things, which is a bit more tricky. So that's heart side of things. And then when it comes to strokes, there's a acronym called FAST. You may have heard that. So FAST, FAST. F stands for face. So if there's facial drooping, one side of the face feeling weak, and then A stands for arm, sorry. Block those for a moment. So A stands for arm. So if there's weakness in an arm or a leg, SC is for speech disturbance. So if you find difficult, if you're struggling to find words and they're not coming out as quickly as they should be, if there's some slurring, then you have to think about a stroke. So T is for emergency calling, basically, the time to call emergency. So that's the FAST acronym we usually say to recognize a stroke. If you have a facial drooping, arm weakness or leg weakness with difficulty in speech, you should always think, right, I may be showing signs of a stroke, and you seek medical attention immediately. Now, there's an entity called mini stroke. Mini stroke is you get these symptoms, but they go away sometimes in 5-10 minutes. Sometimes it can take 3-4 hours, so basically under 24 hours, symptoms fully resolve, but you should not ignore, because if you see a doctor and if they pick up these things, they probably can start on medications which would prevent you from having a full-blown stroke. So that's stroke and mini stroke. And now the third entity, that's what we call as peripheral vascular disease or blocked arteries in the legs. Let's say every time you exert, you start getting pain in your calf muscles or your buttocks, then you have to think, maybe I'm having narrowed arteries in my legs. So to get your legs checked by a vascular surgeon, you do lots of, there are various types of scans to recognize whether there are narrowings in the in the leg arteries. So those are the main symptoms, I would say, of the heart side of things, the stroke side of things, and also the leg arteries. Now, how can one recognize the asymptomatic phase of all of these? Now, that's quite tricky. Unfortunately, when you say it's asymptomatic, that means there are no, it's like tip of the iceberg, isn't it? We see what's out, but there is a lot going underneath. That's where the screening would be helpful. For your routine health checkups, have some screening, to have the blood tests, and pick these things up before it progresses to a level where it can cause symptoms, or it can cause a heart attack, or it can cause a stroke. So that's unfortunately, if one has progressed to a level where you've developed symptoms, yes, it's good to recognize them early rather than late, for sure. But it's even better if we can recognize them before you develop symptoms.
Doctor, on a quick follow-up question on that
Yeah.
particular matter.
Yeah.
Is there a particular age that they should be cautious of these symptoms? Like when you ordinarily, before our generation, the age of 20 to 30 was clearly a no scare zone. But now we see people aged between the 20s and 30s constantly being falling victims to heart-related diseases. So with the progress of time, doctor, is there a particular age that we should be more cautious regarding heart-related diseases?
So in England, you're right. We start screening at the age of 40. When you reach your 40th birthday, you get a letter from your GP saying, right, happy birthday, but come for your blood tests, to have all these things checked. I think, unfortunately, 40 is too late in our part of the world. We South Asians have a tendency to develop cardiovascular disease pretty earlier on, and with the lifestyle changes, not to the better side, but quite the opposite, and with our urbanization, pollution, and all of that, I think there's no recommended age cutoff at the moment, but in my view, I think 25 is a good age to start having at least some initial blood tests. If you look at the disease process, actually the disease process starts pretty early on in your late teenage years. So the cholesterol plaques that get deposited in the arteries, the first forms are called fatty streaks. So just lines of the cholesterol plaques, and they start appearing in your late teenage years or early 20s. So in fact, prevention should start, one could say, at childhood or in primary school, secondary school. And then you could argue prevention should start at the maternal stage, where when the mother is pregnant with the child. Then going backwards, you could say, for that mother to be giving a birth to a healthy child, that mother should have preventive strategies in her adolescence or even before that. So you can see how you know, it's never too late to start at any stage of your life, for sure. But sooner the better, earlier the better, in my opinion. So to answer your question directly, in my opinion, I think maybe mid-20s at least start a blood test. And maybe when you're going out of university or law college, or if I have the authority, I probably would say you get your degree certificate only after you forward me your blood test results. So that sort of thing, I think, as a ballpark figure.
Interesting. Doctor, moving on. Now, lawyers and members of the legal profession, their lifestyles are completely taken over by stress. It's a highly stressful environment that they work in. When they go to courts, they experience a highly stressful environment in the courtroom, and coming back to work in their chambers also occupies a lot of highly stressful environment. So, is stress a contributing factor for heart-related diseases? If so, how does that work?
Yeah, unfortunately, it does. Now, early evidence suggests that, or there is documented evidence that stress would lead you to have high blood pressure, which is a very well-known risk factor for heart artery disease or coronary artery disease, stroke, all of that. In addition to that, in addition to stress causing high blood pressure, there's evidence to say that it causes what known as inflammation. That's Inflammation is like sort of a reaction the body puts out to an injury. For example, if you have a wound, you may see the skin around it being red, sometimes a little itchy. Now that's the local inflammation in that healing process. Like that, there's low-grade inflammation that's going on in our bodies. So there's now evidence to say that the more stressed you are, the higher the stress hormone levels in our body. So the stress hormone levels known as cortisol and all, and they produce these pro-inflammatory chemicals released into the bloodstream, and that can cause low-grade inflammation. And if you have a cholesterol plaque in your heart artery, let's say just 30% cholesterol plaque, which is not narrow enough for you to have any symptoms. But if this plaque has got a lot of inflammation on it, a lot of we call it vulnerable plaque, then even a 30% plaque can rupture and cause a blood clot formation and cause a heart attack. So stress, yes, unfortunately, it does have a direct relationship, not just by leading to other risk factors, but a direct relationship as well to cardiovascular disease. It's we all have stressful moments in our jobs. I don't think I'm the most suitable person to talk about relieving stress or how to calm your mind. And but there are, I mean, if you look at Western curricula now, mindfulness is incorporated into school children's schoolwork, right? It's formally in their curricula, practicing mindfulness and those things. I think it's not that difficult to find a good mindfulness program, yoga. There are so many other things that are out there that one can start practicing to try and get our stress levels down. Easy said than done, but we have to get on with it, I think.
Also, Doctor, now, since stress is an integral part of many lawyers' lives, there are also certain negative consequences of that. Now, for example, lawyers have developed certain behavioral habits such as lack of sleep and also to relieve stress, uh, maybe occasional use of alcohol and tobacco. How are these behavioral habits correlating to cardiovascular diseases, according to your opinion?
So there are unfortunately conventional risk factors as well. I mean, if we talk about heart disease, we cannot talk about heart disease without talking about smoking. And as we discussed, stress, lack of sleep, high blood pressure, high cholesterol, diabetes. So they're all interrelated, isn't it? So unfortunately, as you said, certain professions, especially involving desk jobs, stressful jobs, lead to a lot of other unhealthy habits, such as unhealthy eating, sedentary lifestyles, lack of exercise. These become, unfortunately, a vicious cycle. And obesity. So alcohol also now, the latest evidence is actually no college would recommend alcohol in any amount. That's the latest evidence. But it's certainly when it goes beyond a certain level, the harmful effects are certainly more than the beneficial effects. So we have to be mindful. Smoking, I think it's a no-brainer. As the pact says, smoking kills in many ways. So that's the blatant truth. And then one got to be mindful about these risk factors and make use of every opportunity you have in your day-to-day life to mitigate them. That's the whole point of, I think, this conversation. So if you see a staircase, take that instead of taking the lift. And that could be your free gym in your day-to-day work. If you can walk without taking a taxi or without taking the car. So if there's a cycle, get the cycle out. That's, so keep moving. Being physically active is very important. And then healthy diet. So that's also difficult with our fast-moving lives, isn't it? We depend on a lot of ready-made food. So, but we'll talk about primary and second prevention later on. So these are all part and parcel of that. So recognizing, I think, is important. And to be in a non-denial state is also very important. Otherwise, you just ignore it.
Doctor, since you spoke of the consequences and the consequences of smoking and how it relates to cardiovascular diseases,
Yeah.
there is a common misconception, maybe practiced worldwide and also in Sri Lanka, where people think that practices such as vaping is an alternative for the use of tobacco and that it does not contribute to heart-related diseases. But now, in the recent examples we see in countries like Singapore and Malaysia, there's been a huge increase of vaping and vape-related products. Now, those governments are introducing policies and bringing in regulations to contain the practice of vaping. What is your opinion about this misconception of vaping being an substitute for smoking and that it has no impact for heart-related diseases? Is that true? And what is your insight on that, doctor?
I think we are in a dark zone still. It's a bit like how smoking was taken up as a fashionable thing in 40s, 50s, 60s when it was first introduced, right? People didn't know the long-term effects of smoking until late. And I think vaping is also like that. We do not know the long-term effects of vaping. So no healthcare system in the world recommend people to take up vaping instead of smoking. Or take up vaping newly. If someone is addicted to smoking as a way of getting rid of that, yes, sometimes some healthcare systems do recommend at least to switch to vaping, but it's never to say that vaping is good. So I think that's definitely a misconception. I think, with time to come, these are all chemical fumes and substances. I don't see how it can do any good in the long term. We don't have long-term data. So I would have a strong word of caution against such practices where we don't know much about. So I would certainly discourage vaping altogether.
Also, Doctor, now since you spoke of the dangers and risk factors concerning cardiovascular diseases, as members of the legal profession, what are the primary healthcare programs that lawyers and also people in general society can resort to for the purpose of detection, treatment, and prevention of cardiovascular diseases at an early age?
Yeah. So two two types of prevention. That's primary prevention and secondary prevention. So second prevention is the prevention of a second episode after the first heart attack or stroke or blocked artery in the leg. Primary prevention, in my opinion, is the best way for a country like us, especially with the resource poor settings, where the costs are low and the gains are huge. So we should put all our effort for primary prevention, but of course we cannot forget secondary prevention for the people who have already had to experience the ill effects of these, of cardiovascular disease. Unfortunately, we don't have a good primary healthcare network at the moment. From what I hear sound bites that government is going to start, I think 10,000 primary care centers, and I think similar to kind of a GP network that we get in England. I mean, if that is successful, I think that'll be great. That's very timely. As I said, never, late than never. So I hope it'll be a success. Until then, unfortunately, we'll have to go to our GP or physician or cardiologist or whoever the doctor you can find in terms of screening tests. So primary prevention, that is like preventing cardiovascular disease. So lifestyle, healthy eating, and screening and detection early. So I'll speak about exercise. So I mentioned a few words before about being physically active. What the current recommendation is, at least half an hour, 5 days a week. So that's the current recommendation. Even if you can't do that, any physical activity is better than nothing. As I said, take the stairs, maybe do some push-ups before you go to work in the morning as soon as you wake up. Something that you can build into your routines. Even if you can't find time to go to a gym, something small is better than none. So physical activity is very, very, very important. I cannot stress the importance of that. Stress enough the importance of that. And then healthy eating. This is a really big issue in Sri Lanka. So when I came back from UK, I think, as you heard, I was there for about 15 years, and it was a shocker to me to see what has happened to our eating habits, how much we're dependent on fast foods, junk foods, and how we have resort to celebrate junk food. And, we would have our children's birthday party sometimes in one of these junk food places, right? So it's gone to that level. I mean, let's be honest. If you take England, for example, I'm not trying to discriminate, but this is the sad truth. You see certain category of society who would go to these junk food places. Unfortunately, people who cannot afford a good meal, who cannot take the family, or who are low in their educational status, low social background, economic background, those are the people who would patronize these, fast food eateries. But in Sri Lanka, it's sadly not quite the case. Sometimes even the so-called educated, the well-to-do, who can afford a good meal, who can prepare a good meal at home, would switch to, and setting a very bad example to the rest of the society, in my opinion. So I think we have to revolutionize our eating patterns. As a nation, my observation is we eat too much carbohydrates, for sure. When our grandfathers or great-grandfathers were farmers, working on the fields, yes, this level of 3 meals of rice or, half loaf or loaf of bread probably was okay, but not now. We don't spend that much energy in our day-to-day lives. So we're certainly taking more carbohydrate than we should be. And then the way we process, the way we cook food, that's the other thing. We want to put all sorts of oils and coconut milk and everything to every curry we make, every dish we make. And then lack of regulation. That plays a huge role when it comes to fast food. So even the 5-star hotels, if you go to a meal, you'd see how many times they use the oil to fry the cuttlefish or the prawns or whatever, isn't it? I mean, every time you reuse oil, it becomes poisonous. It produces trans fats. So these are things that we got to be aware. So I would say, I can talk for hours and hours about healthy eating, but at least to be aware of the concepts of healthy eating, like, when you serve um, a meal to your plate, use carbohydrates to maybe 1/3 of the plate, and the next 1/3 maybe vegetables, and the other 1/3 proteins like fish, and then maybe a salad, rather than serving a full plate of rice and serving curries on top of that. So those little changes would go a long way when they're practiced daily. And the other thing I would say is, I can, by looking at someone's shopping trolley, I can probably get an idea about the inside. Not always, I can't be correct always, but I get, I get a, and I sometimes feel, really bad when I see like families with kids and what they buy. So my advice is stop at the fruit counter, stop at the vegetable counter, stop where the grains are, stop at the fishmonger and where the meat is, and avoid all the other aisles in the supermarket. Don't even look at them. And if you can have whole food, unprocessed food in your shopping trolley, I think that will be the beginning of healthy eating, not just for you, for your kids and for the rest of the family. So exercise, healthy eating, and then the third thing we talked about was to detect early. So that's where the blood tests, blood pressure measurement, sometimes an exercise ECG or an echocardiogram or both could be helpful to pick things up early. A scan in the neck to look at the arteries in the neck. So detecting early. If you detect, high cholesterol in your early 30s, and you try your level best by changing your lifestyle or dietary habits, and if you can't, if you go on a medication, you'd reduce your future heart attack risk significantly. But if you go unnoticed and you continue your same old ways, I think the future will not be good. So detecting early is very important. And then, of course, to have follow-ups, to regular follow-up, what my cholesterol. So sometimes I see, we write medication for 6 months and say we'll review in 6 months. Sometimes what patients do is they do a cholesterol check. Oh, well, look, it's normal range. I stop my tablet. Next time they come back is in another 3 years' time when they've had a heart attack. So it's like that. Similar with blood pressure, isn't it? You take a blood pressure tablet, 3 months later, you check blood pressure is normal. I stop it. And they come back with very high blood pressure later on. So I think, information, education, follow-ups, and then watching your own lifestyle, diet, obesity. So central obesity. I mean, how common is that in our part of the world now? You can do your own survey by looking at, our population of above 30, both men and women. It's such a simple thing. When you stand in front of a mirror, if your waist is bigger than your hip, you have got central obesity. You got to realize that metabolically something not right is happening in my body. And that's the time to act before it gets too late, isn't it? Maybe I need to exercise more. Maybe I need to cut my calorie intake down a little bit more. Some discussion, some thought about that rather than just ignore it. And I would really like, especially the young people also to think about this. As you very correctly said, we are seeing just phenomenal amount of young people coming with heart attacks, which was not the case in England. If you have a patient with heart attack coming with less than 50, we would be very surprised, and everyone would be like, oh, there's a young heart attack coming. Here, most are in their 30s, 40s, 50s. So yeah, we have to do something drastic to prevent these things.
So,
Sorry,
Dr. Now,
I get very passionate about these things.
understandable. Also, Doctor, now in usual hospitals, we find routine health checkups or other medical checkup programs. So
Yeah.
that is a general set of tests that are run for a patient in the form of packages.
Mm.
Now, does the ordinary normal package cover all the risk factors or the tests that would ascertain the possibility of a cardiovascular disease, or is there any other special test that one needs to look into and do extra or beyond the routine health checkup mandate in being cautious?
So most packages would have the very basic things like your blood pressure check, your blood sugar, your cholesterol. Those things would be included in almost all the packages. So that's good. Rather than not having any test at all, that's good. And then there are certain cardiac dedicated, cardiac dedicated packages where you'll have echocardiogram, XICCG. And then going beyond that, there are some packages where actually you'll get to see a cardiologist to discuss your lipid profile, to discuss. So I guess those things are, designed in a way, keeping costs in mind. All those other things are playing as well. If I think the best is, have these tests done. If you're not having any checkup, at least have that. That's better than nothing. And then sometimes what I say is have all those. And if you've not seen a cardiologist, if you've not seen a physician, maybe, or not seen a doctor with that, go have a chat about these results individually. Because sometimes now, I can give you examples. There are certain packages where they have an echocardiogram with us and they have an XICCG, so I report on the XICCG, but I never get to see the patient in detail. I don't get a chance to speak to them. I don't get a chance to go through the other blood results. So it would have been better if that's the case. So not all the packages included. So yes, and then the management would say, okay, we can't include everything in every package. So there are difficulties. I think the best thing is you'll have a physician or a cardiologist or somebody or your GP who you're comfortable with having a conversation. You should see that person with the results you get in these packages to see how you could optimize. Yes, there are novel blood tests, there are novel screening tools that we can use to detect additional risk factors. Even imaging like, CT coronary angiograms, those things as well are used, but they should be used with proper knowledge. You can't, nowhere in the world CT coronary angiograms are prescribed freely just as a screening tool, and people got to understand the implications of that as well. And sometimes you can get drawn to treat sometimes narrowings that are not really need treatment just because we have now detected something and now we have to act upon it, like that. So it's important to have that understanding of the test that you are having, why you are having it, and what it can lead to as well.
Doctor, one of the important things that you mentioned in your discussion was that the high likelihood of heart-related risks in countries like Sri Lanka as opposed to countries like England. I think even the WHO has identified this trend where heart-related diseases are high risk in low and low middle income countries, especially like South Asia, and which would also invariably include Sri Lanka.
Yes.
Now, lot of professionals, especially from the legal side, they go through routine health checkups once in 6 months, once a year. But as you correctly said, that may not entail all the cardio-related examinations like an excited ECG or even seeing a cardiologist. In your expert opinion, how often should a person do an excited ECG? Is it once a year, once in 2 years? And how often should one go see a cardiologist, given the context of heart-related risk in countries like Sri Lanka?
So it's very difficult to for me to say. Certainly, there's no need to have exercise ECGs every year. There's no need for that. If you've had one normal one this year, there's certainly no need to have another one next year. No need of that. But equally, I think the best way is you see at least once, and then you have a chat with that cardiologist. When do I have to see you again? So some patients we see once a year, maybe just a lipid profile, right? And then in 2-3 years' time, we may do another exercise ECG or something, right? Or you can see your GP and the GP can refer to cardiologist every 2-3 years or something like that. But it partly depends on your patient's risk profile as well. If someone is low risk with no medications, it's just a matter of getting a lipid profile, blood sugar and those, they may not need to see a cardiologist, to be honest. Not every year, certainly, right? So it's very difficult for me to say in a blanket version. But this notion of having exercise ECG every year, I certainly don't like that. Sometimes I see people have it every year, but the things that can actually do, things that are under their power to do, they're not doing. They have not lost weight. They have not improved on the risk factors, but they happily come and have the exercise ECG every year. So that does not mean anything. I mean, okay, it's good to have a normal exercise test, but there's certainly exercise test is also like only 80% accuracy, roughly 70 to 80% sensitivity and specificity, right? Having a normal exercise ECG does not mean everything is hunky-dory. So there are things that you can do actually much, more important things than having an exercise ECG every year, in my opinion. So there's no one prescription for everybody, unfortunately. But it's I don't know how to answer your question. I mean, at least once see somebody with all the results and somebody who can spend some time with you. I have to stress that as well, unfortunately.
Doctor, you've been answering my questions for good 45 minutes. I think it's time to go for our participants also. There's one
Sure.
question I think raised by Mr. Viraj Vikramaratne. The gentleman is asking, in the Sri Lankan context,
Yeah.
do males or females, whether it's males or females, that get heart attacks more?
In every context, males have a higher risk than females. That's for sure. One thing surprises me here is normally, like you say, for example, I have not lived in other countries other than Sri Lanka and UK. So in UK, the women, menstruating women, the risk of cardiovascular disease is very low. But here, for some reason, even women in their late 30s, 40s, we see with very bad coronary artery disease. I do not know the reason for that. But a trend that we certainly did not notice in the UK. So to answer that question, yes, men are always at higher risk than women, but in our part of the world, we have to be careful when we screen the females as well.
All right, we can go for more questions from the audience. If the participants can, there's a question to Dr. Vikramarati. You are most welcome. Right, doctor. So we've spent like good 45 minutes discussing cardiovascular diseases. And one last question, right throughout your discussion, you've given us big no's on junk food, big no's for alcohol, for tobacco. When I ask this question, I ask it on behalf of fellow members of the legal profession also. Is there any, can you recommend us or propose to us a way to balance our health, our lifestyle, whilst also enjoying the finer pleasures of life?
Yeah, I think it's doable. It's doable, and I draw. Sorry, I keep going back to how things are in the UK. I mean, I think, in my opinion, there are many good things for us in Sri Lanka, but there are certainly good things that we can learn from other countries as well. Now, I see, 8-year-olds walking the dog in the middle of the winter religiously. Right? I wouldn't even think of going out of the house. No, doctor, I've been walking the dog every day. No problem, doctor. Right? These are 8-year-old, grandfathers. And so the attitude is very, very different. The attitude to keep healthy, stay healthy, to be active, that's very different. And we got a lot to learn from those cultures. I'll give you an example. Like my parents visited me once. My father is an avid walker, my mother may not be. But they came back. I remember the first time around, they were at the end, they were walking like 3-4 kilometers a day. They get out of the house in the summer, you see a lot of other people walking. There are lots of walking parks and all that, of course, the facilities are there. But you get encouraged when you see other people physically active. You get that into your blood, you develop a habit. So do we have to do all the bad things we talk about to enjoy life? I don't think. And then the other thing is eating. Like if you cut down on the level of carbs and the level of sugar we take, actually you'll regenerate your taste buds. You'll find that you start tasting lots of other flavors in a very different way. Believe me, that's will introduce you to a whole new life. And you will start, you'll have chef's books at home or you'll have a hobby of, doing up, making dishes with your children or something, going out for a walk, doing some exercise together. So I think it's the way, okay, now, we don't have to drive even 2 hours to get to a beach, do we? For most of us, if you drive 2-3 hours max, we'll be at a beach, right? But how often do we make use of that? And we can do that 365 days of the year. So to me, like, we are in a really good place to do all of these activities. And you go to a Sunday polar somewhere, right? You see the variety of vegetables. It just amazes me, right? For someone who's used to buy things from supermarkets for most part of my adult life, when I go to Polar, it really amazes me to see the variety we have in Sri Lanka. So eating unprocessed whole food is very easy in Sri Lanka. Sourcing fish, very easy in Sri Lanka, right? The really oily, healthy fish. So I'll tell you the 4 types of fish, the healthiest, with the ones with the highest amount of omega-3 in Sri Lanka. You'll be surprised. Kumbalavu, Hurullo, Karallo, and Linno, right? So I tell my mother, I came back to Sri Lanka, I look at, now I can't tell people to eat salmon and trout. What do I, what do I tell my patients to eat? So I did some literature search. There was a really nice paper done by some Sri Lankan and Swedish scientists assessing the omega-3 quantities in Sri Lankan fish. And these were the top 4. And I asked my mother, you never cooked kumbala at home, but that's the healthiest fish. She's like, oh, okay, Ushnayan, see, this is the thing, isn't it? We ourselves have curtailed a lot of good things we have. So now I tell all my patients religiously, have 2 kilograms of, you can't eat kumbala every day, of course, but be aware that these are the healthy fish. Anyway, fish is better than red meat, any type of fish. So it's not, so to live a healthy life here, to enjoy life, it's not difficult in Sri Lanka. You don't have to be rich to do that, in my opinion. It's to have the right attitude is the most important thing, in my opinion. I hope I answered your question.
Very, very, very clearly, doctor. There's one more question from the audience by
Yes.
Sunil Vithanage is asking whether the fatty liver condition is interrelated with cardiovascular diseases.
Yeah, absolutely. Absolutely. So this is all part of metabolic syndrome. And if it's early stages, something that you can reverse. So the things that we were talking about, central obesity, when your waist circumference is bigger than your hip, with central obesity, then you start developing fatty liver. And it's interrelated. High blood pressure, coronary disease, stroke, they're all interrelated. To answer that question, yes. But you can reverse it. If you act early and if you act decisively, you can reverse most of this.
Doctor, we've almost spent like nearly 1 hour in this
Nearly 1 hour, yes. Yeah.
insightful discussion.
Yeah.
So, are there any concluding remarks that you would like to make for this audience? especially regarding their lifestyle, their health, and their the possibility to avoid cardiovascular diseases in as legal professionals who are leading a very busy lifestyle. What are your final thoughts and final remarks for?
Yeah, take home message would be keep moving, keep moving. Eat healthy. Say no to processed junk foods. Eat healthy. Keep moving. Eat healthy. Do your screening tests. Those will be my 3 messages.
Thank you very much, Doctor. We are most grateful for sparing your time with us. And I think this was a very insightful discussion and a lot of take-home messages for lawyers to stay healthy whilst also doing their professions and living through a stressful environment, but the importance of staying healthy and also doing their regular checkups. Thank you. Thank you for your valuable time, Doctor.
Thank you for having me. Great honor. Thank you.
Thank you, Mr. Doss. This brings us to the end of the webinar titled Mitigating Cardiovascular Risk for the Health and Well-being of Lawyers. I thank our esteemed panelist, Dr. Uppul Wickramarachchi. Dr. Wickramarachchi holds MBBS from the University of Peradeniya, Doctor of Medicine from University of East Anglia, UK, and also a member of Royal College of Physicians, UK, and a board-certified cardiologist in the United Kingdom and Sri Lanka. Dr. Wickramarachchi completed his internship and subsequent medical cardiology training in the National Health Service in the United Kingdom and worked there for 15 years before returning to Sri Lanka. Dr. Uppul Wickramarachchi is currently discharging his duties as a consultant interventional cardiologist at the Lanka Hospital, Colombo. I also thank our moderator, Mr. Migara Das. I thank Dr. Wickramarachchi and Mr. Das for the fruitful and educational discussion and for dedicating your time to be here with us and sharing your insights. I thank the BSF Webinars and Legal Symposiums Committee for their dedication and hard work in organizing this insightful webinar. And last but not least, I thank all of you who have joined in for this session today through various platforms and for the interactive discussions we've had. Thank you, and I hope you all have a good night.
Thank you. Thanks, Mr. Good night.
Good night.